So Biose Industrie is the company I'm working on. I'm head of program in this company, which means that I'm making the link between the clients and the operational to be sure that your need is completely respected from the beginning to the end. So any customer arrives with Biose Industrie saying, I got a bacteria effective toward this pathology, and now I need to make this bacteria as a drug. We are proposing our expertise and services to manufacture the bacteria as drug substance, which is the lyophilized part of the bacteria, and then as drug product. So drug product can be either capsules for oral dosage form, either topical option, either tablets, really depending on the need you have on the bacteria. My job actually consists into bringing some expertise from the beginning to the end of this program. So basically, Biose will be able to help you with, because we got a team of bioinformaticians and microbiologists. We are helping you looking at the whole genome sequencing data analysis of your strain, and then checking the right parts you need to check with the authorities to be sure that your bacteria will be ready to use on the market. So we'll, for example, give you a map on which we check if your strain is having some resistance genes towards the antibiotics, if there is some phage content, if there is some prophage, if there is some specific markers of any genetic instability, and we'll give you the complete map and telling you if you want to go further with this bacteria. This is okay, there is nothing to do more. This is not okay, we'll advise you to look forward, for example, for the phage expression, for the resistance assay of your bacteria, etc., etc. We'll help you fill the IND dossier to be ready to sell your drug. As soon as we help you looking at the whole genome sequencing, we will help you regarding drug substance process development, so the free lyophilized bacteria. We have really fermentation capabilities and currently about 40 technicians and engineers dedicated to these activities. So they take your bacteria, they look about their need and the high potency you will have on the drug substance manufacturing. So we got microplates readers, we got bioreactors, small scales, because we are working from 2 liters bioreactor up to pilot scales with 150 liter bioreactor. As soon as the process is done in bioreactor, we work on the concentration, so TFF, centrifugation, and then the lyophilization to have a dried bacteria which will be stable over time. As soon as you got drug substance, we work as well with drug product, because that's a thing to have a lyophilized bacteria, but you need to have the form on which you will use this bacteria. And so Biose is able to help you regarding the drug product form. So we're working with capsules, with tablets. We got a lot of experience because Biose Industrie is actually quite an old pharmaceutical company. We were founded in the 1950s, and so since then we are working with bacteria as drugs. So we are making tablets, capsules, cream and oils. The fact is that we will formulate the drug substance in the right way to have something stable and ready to deliver. We are currently really focusing on the way to determine in which part of the intestinal tract, for example, a capsule will release the API. And in order to do so, we develop specific bending and coated process at the moment. So it's to take a capsule or a tablet and then to put a specific resistance around to be sure that it will release on the right part. What we are able to show is that currently on the market, there is ready-to-use capsules that is saying, yes, this capsule, if you put your drug substance in it, you will pass the stomach and then you will arrive in the intestine. When we test it in the lab, we see that there is a case on which this is true, on which this is not true. So the objective of Biose Industrie is really to drive you to the right partner to work on. And if there is no available solution in the market, for example, if you tell me you want to go in the colon, which is the part of the intestinal tract on which usually you want to deliver the API, Biose will help you by formulating a specific protection around your capsule or your tablet to find the right way to deliver. At the moment, we got a specific test because we got an analytical department which is developing an analytical method. And in this department, we saw that there is the right formula to resist to the gastric part, then to resist to the first intestinal tract, and then to go in the lower part. This is quite a pride in Biose because this is something that we work with the authorities to prove that the current specification, which is considered by the pharmacopoeia, which is the USP or the European pharmacopoeia, is not precise enough to discriminate which is the drug product going to the upper part of the intestinal or to the lower part. And Biose currently got capabilities to help you go through this description. So we manufacture drug product, but as I explained before, we are manufacturer, but we are making process development, which means we really adapt to the need of the market, of the client, but as well to the regulatory, because we manufacture a lot of drug substance and drug products, so we submit more than 25 dossiers to the FDA and the USP per year, so we have a lot of feedback since more than 7 years from now, and so we adapt anytime the regulatory part of our product, anytime. So if I told you we did something 2 years ago, that's really not what we will do on today, and that's part of my job, and that's part of what is exciting actually with working with Biose. So as soon as you got your drug product, you believe this is done. This is not, because there is the analytical part to finalize, to submit to the authorities. Then there is the clinical labeling. Then there is the regulatory part. And Biose got a really expertise on all of these fields, because we are a pharmaceutical company, which means that we are manufacturer, but we got a quality assurance, a regulatory affair, we got a QP for the release, and we got the quality control directly in-house. So all of this together, we consider Biose is an end-to-end solution for manufacturing bacteria to a drug, and that's what I talk to the Microbiome Movement Congress in London.